Yeah. This is the Think Humanity Clinic in
Think Humanity Community Health Center.
Think Humanity Community Health Center in Hoima, Uganda.
Yeah.
On your left is Cecilia. Say hi, Cecilia.
Hi.
And Faith in the white t-shirt. She is an RN, one of the nurses here. And this is Teddy.
Hello.
She is our clinical officer, or what we'd say a doctor. And this lovely pregnant woman here is Jane. She is also one of the nurses. So I'm going to take you through like a patient would. And this in here would be a patient treatment room where dressings would be done and such, injections. We have a bench here for people to wait. There's also a place for the cashier, which is Cecilia, to pay, nominal fee. Then over here would be the pharmacy door where you get medicines. They'll take us into where they store the medicines. This is the consultation room to talk to the patient and decide what is wrong with them. We have an exam table here and a scale and a desk. And then in this room is where we keep some of the medications. And she's going to open the cabinet for you. And then they dispense medications from here. Including ointments, salves, injectables. They have quite the supply. I'm going to show you. These are some of the medications, supplements, and creams, Neosporin. They also have IV fluids and such. And we're going to go around the other way through the door. And we're going to take you through to the other room. They have an office here, a nurse's room. Pascal's opening their storage room that we're going in. This is storage for medications, IV fluids. These are some of the things we brought yesterday. Medical equipment, eyeglasses, dental kits. This is where all their oral medications are, syrups, ibuprofen, Tylenol, gloves. You get the idea. They also have men's quarters here for where if they do have some gentlemen to stay, they put them in this room. Most of the patients they treat are women and children, and that's in another quarter. That's the office. We'll take you back to where the women's quarters are. We'll go outside. This is the second back building where the women stay. We have one patient here with syphilis currently. And these are the beds. You see the mosquito net. Here's an example of a bed. The pole is used for the mosquito net and IV fluids. And we'll go back outside. They also have a lab here with a lab tech that takes blood. Well, Bruno actually is here. We're going to go say hi to Bruno in the lab. There we go. This is Bruno. Yeah. Say hi, Bruno. He is our lab technician. They have one microscope. I was glad to see they also have a sterilizer, or what we would call an autoclave. It's a bit small, so they have to be careful about how many instruments they use. And he's got his reagents up here and stains. There's the little tubes here you see are for blood to check. They figure out what's wrong with the patient, and then they can treat them. They do have one refrigerator for shots, but the power goes out much of the time, so we're going to see about solar power to fix that problem. And as you can see, they have patient education information on the walls about mosquito nets and how to use them, how to repair them. The patients come in and sit right here to have their blood drawn. And they also give mama kits away to women. They take them to the hospital if they need to. That gentleman right there is Frank. He is the janitor and keeper. There's a jerry can used for water. Frank is the one who did this wonderful path with the beautiful bushes, making the area beautiful. This pit is for trash. They do have a source of water. That's Frank. He helped us very much today planting our garden. Thank you, Frank.
Thank you so much.
And as you can see, the grounds are very beautiful. They have some trees, area to cook, and what you're looking at now is the garden that we planted just today and finished. The food will be used for the clinic and the girls' hostel nearby, which is about a mile. So we planted tomatoes, squash, beans, peas, melons. They have a new brick wall around the clinic for safety. Now we're back around the entrance. We'll go back up again. And this is the entrance of the clinic. Frank has built or planted many plants, and he's done rock work to beautify the area. They have also built what's called a canteen. This is a store. They have some food and water that you can purchase here. Out in the back is facilities for men and women to bathe. So that's the Think Humanity Healthcare